Yeah, I'm gonna turn it on.
Okay. Good morning, everyone. I'm going to ask if everyone can take your seats. Get started. Thankfully, indoors in air conditioning. Good morning and welcome, everyone. My name is Elsie Taveras, and I am the Chief Community Health and Health Equity Officer for Mass General Brigham. And I am thrilled to welcome you all here today for this exciting historic announcement. Today, we are announcing the awarding of $18 million in community health impact funds. That I should pause. That deserves a round of applause. $18 million to 22 organizations to support quality, affordable housing efforts here in Boston and in North Suffolk County. We are so incredibly pleased to be joined this morning by all of you. But in addition to have in our program a few comments from some of our awardees and some of our state leaders, including Dr. Robbie Goldstein, Commissioner of the Massachusetts Department of Public Health, Edward Augustus, Secretary of the Executive Office of Housing and Livable Communities, Jennifer Maddox, Deputy Secretary in the Executive Office of Housing and Livable Communities, Sheila Dillon, Chief of Housing and Director of the Mayor's Office of Housing for the City of Boston, and Elizabeth Jackson, President of Bridge Over Troubled Waters here in Boston. And of course, we are grateful to be joined by representatives from nearly all of our 22 awardee organizations, in addition to members of our Community Advisory Board and our Allocation Committee who are in the audience today. You may have noticed as you were taking your very hot walk down Cambridge Street this morning, the kind of small construction project happening just up the hill. We could not be happier to have the Philip and Susan Reagan building, a state-of-the-art clinical facility that will serve as the new home of the Mass General Cancer Center and the Corrigan Minahan Heart Center. The facility will also add much-needed inpatient beds to help alleviate some of the capacity issues experienced across our system. So this not-so-small construction project and the capital expenditure related to the building of this state-of-the-art clinical facility has resulted in more than $62 million being invested in our communities through the Massachusetts Determination of Need process, the largest determination of need investment in the Commonwealth's history. While we are announcing $18 million here today, we are also, through the Community Health Impact Funds, going to be awarding another $44 million that will be allocated over the next 8 years towards other community health priorities that we heard directly from the communities that we serve are the priorities, are the things that are most pressing to the communities that we serve here in Massachusetts, here in Boston. And those are mental and behavioral health, economic mobility and financial stability, and food insecurity. Awards for another $6 million, $3 million for mental health, and $3 million for economic mobility are scheduled to be announced this fall. Investments, combined with our comprehensive community health strategy and other robust community initiatives, Mass General Brigham aims to fundamentally transform our approach to improving community health and health equity. We are focused on the health conditions not only that we hear from the communities that we serve are the most pressing conditions affecting the people, the patients that we serve, but also the greatest contributors to premature mortality, the greatest contributors to reduced life expectancy of Commonwealth communities and patients, but also contributors to the greatest health inequities in Massachusetts, in Boston, and across the country. And those are, to no one's surprise, cardiometabolic disease, substance use disorder, cancer, and maternal child health. Not just to improving health inequities and improving those chronic conditions, but to addressing the root causes of health disparities by strengthening our community-based partnerships to make the greatest impact on issues such as housing instability, which is what we are here for today, improving limited economic mobility and educational opportunities and other social determinants of health. Getting to this announcement today is a result of a lengthy, thoughtful, and comprehensive process that began almost 2 years ago, actually more than 2 years ago, as we were planning, putting together the process for this allocation. The funding priorities were determined by our Community Advisory Board, the CAB, who are trusted community leaders from a number of different sectors, who we are so honored to have as advisors, as the people who really listen to the trusted voices of their community members and bring not just their own life experience and community-based expertise to this amazing process. The CAB is guided by our Community Health Needs Assessment, and once the CAB determined the funding priorities, who receives the money and how it is distributed is the responsibility of the allocation committee. Through a widespread, highly competitive process, the Housing Allocation Committee had the unenviable task of choosing from a wealth of submissions the proposals they determined would have the greatest, most equitable impact on quality, affordable housing through 3 key strategies: production and preservation of affordable housing, policy and advocacy around equitable housing initiatives, and eviction prevention. We are proud to be joined by some of our CAB and Housing Allocation Committee members this morning. For those of you who are here, could you please stand up so we can give you a round of applause? This would not have been possible, and I'd like to recognize Leslie Aldrich, Mass General Brigham's Executive Director for Community Health, and Sylvia Chang, Director of Community Health Impact, for stewarding this important and complex process. Thank you so much, Sylvia and Leslie. As a pediatrician, I have seen firsthand how stable, affordable, quality housing is foundational to good health. One of the very first patients, I'm going to go off script for a second. One of the very first patients that I saw in Boston as I was training to become a pediatrician was a 2-year-old child who lived in the intersection of the South End and Roxbury. That family was getting priced out of their community in the South End, and the family had to make a decision whether to heat their home or to feed their children. This is a family of 5. About 6 months into my residency program, learning everything that I needed to learn to become a pediatrician, that patient of mine came into the emergency department at Boston Medical Center and had died in a house fire that was caused by a space heater because the family made the very difficult decision to heat that home in the middle of the winter in the city of Boston to be able to keep that family alive and warm. And to this day, that kind of the ability and the way that our families and our patients make those decisions about how they live impacts every single aspect of the health that we deliver. It's not just the medicine that we provide. It's not just the prescription that we write for a patient's diabetes or a patient's asthma. It's also the way that we take care of the root causes that worsen their health conditions. And I'll always remember that patient and those really difficult decisions around housing, around heat, around food that my patient and their family had to make. So I know I have seen housing insecurity and poor quality housing and how it's been linked to illnesses such as cardiovascular disease, asthma, chronic stress, chronic diseases, but also to urgent and emergency conditions. While we are all aware of the housing crisis being felt across the city, the state, and the country, we know that this burden is borne disproportionately by communities of color in our own neighborhoods and historically marginalized groups. As a healthcare system, Mass General Brigham is dedicated to expanding and strengthening our collaborations, and we're so pleased to partner with these 22 amazing organizations with equity at their core on these innovative and impactful proposals to support affordable housing in Boston and beyond. Now, it is my great honor to announce the recipients of the Community Health Impact Fund's Housing Awards. And bear with me, because I want to make sure I announce every single one of our awardee organizations. These awards are going to the Boston Affordable Housing Coalition, Mass Alliance of HUD Tenants, Boston Tenant Coalition, Bridge Over Troubled Waters, Chinese Progressive Association, Citizens Housing and Planning Association, City Life Vida Urbana, otherwise known as Urban Revival, Inc., the City of Boston Mayor's Office of Housing, Dudley Street Neighborhood Initiative, Family Aid Boston, Greater Boston Legal Services, Green Roots, Harbor COV, Homestart, Homes for Massachusetts, Legal Services Center of Harvard Law School, Madison Park Development Corps, More Than Words, New England United for Justice, the Neighborhood Developers, Transgender Emergency Fund of Massachusetts, Urban Edge, and the Women's Lunch Place. A round of applause and congratulations to all of our awardees. We could not be more pleased. And now I'd like to introduce Dr. Robbie Goldstein, Commissioner of the Massachusetts Department of Public Health. Robbie.
Good morning, everyone. Thank you, Elsie. It is really great to be back here at the MGH, a place that holds a very special place for me personally. This is the place where I learned and I refined the way I practice medicine. It's where I took care of patients every day for a long period of time. And it's a place that showed me and helped define for me how extensive and far-reaching medicine and healthcare actually are. It was the leadership of this institution who gave me an extraordinary opportunity to put a vision into place. It was a vision to create a program that would provide affirming, inclusive, equitable care to a historically marginalized group of people who are too often excluded from traditional medicine. For me, the MGH is a place that has always taken the words of its founders to heart. When in distress, every man becomes our neighbor. Or as I used to say in the transgender health program, when in distress, every person becomes our neighbor. This simple phrase from the hospital's 1810 circular letter reflects an understanding that health involves more than just good physical care. Years at CDC and now for my perch as commissioner at the Department of Public Health, my definition of high quality care has expanded even further. It's exponentially further, in fact, from what I learned here. Beyond medical care, it's beyond nutrition, it's beyond exercise, beyond clean air and water. There's a critical role and an importance of safe and stable housing. The place that we call home is more than just a roof over our heads. It's the foundation of our physical and our mental well-being. At DPH, we see firsthand how housing conditions impact health outcomes. Our public health data warehouse enables us to analyze the complex relationships between housing and health, and what the data continue to show us is sobering. Inadequate housing conditions are strongly correlated with a range of health issues: exposure to mold, to lead, to other environmental hazards. Substandard housing too often leads to respiratory problems, developmental delays in children, and other chronic health conditions. And overcrowded housing can contribute to the spread of infectious diseases, which we all saw so clearly during the COVID-19 pandemic. Housing problems involve more than just the physical structure of the home. Housing instability and homelessness have profound effects on both physical and mental health. The stress of potential eviction or foreclosure can exacerbate existing health conditions and lead to new ones. The impact of housing instability on children can be devastating, with disruptions in education and social development and long-lasting impacts on health, well-being, self-confidence, and sense of self-worth. Moreover, where we live determines our access to other health-promoting resources. Safe neighborhoods with green spaces encourage physical activity. Proximity to grocery stores with fresh produce supports better nutrition. Access to reliable public transportation can mean the difference between making or missing a crucial appointment. Recognizing these links at DPH, we're committed to addressing housing as a key public health issue, and we're working closely with other state agencies, local health departments, and community organizations to develop comprehensive strategies that address both housing and health. Funds that the MGH is providing to local organizations to support affordable housing initiatives in Boston and North Suffolk County will offer much needed support for improving housing accessibility, quality, safety, and stability. The link between housing and health is not just a matter of public health, it's a matter of equity and social justice. Housing disparities too often fall along racial and socioeconomic lines, contributing to the health inequities we see in our communities. By recognizing and supporting housing as a critical determinant of health and taking concrete steps, as what's happening today, to help provide safe, stable, affordable housing for all, we can make significant strides towards improving public health outcomes and reducing health disparities in Massachusetts. So I want to thank everyone here for your partnership in addressing this crucial issue. Together, we have to continue working toward a future where every resident of the Commonwealth has access to housing that supports their health and well-being. And with that, I think I'm turning the podium over to Secretary Augustus from the Executive Office of Housing and Livable Communities.
Thank you, Commissioner. And I'm joined here by our Deputy Secretary, Jennifer Maddox, from the Executive Office of Housing and Livable Communities. And first and foremost, I want to thank Mass General for being such leaders. This museum that we're in exemplifies the leadership that you've played historically in medicine, making great breakthroughs that have had profound impacts on the way medicine and healthcare is delivered to people across the world. And today, once again, you're providing that leadership, that innovation, supporting housing that we know is a critical social determinants of health, as the commissioners mentioned and previous speakers have mentioned. Everything else comes from the foundation of being housed in a safe, healthy place. It is next to impossible to work on food insecurity, mental health challenges, substance abuse disorder if you don't have a roof, a stable roof over your head that's healthy. And the Healy-Driscoll administration is all in on the housing crisis. Our historic bond bill that's moving its way through the legislature and hopefully will be on the governor's desk in the coming weeks brings another $4.1 billion of resources to combat the housing crisis, and many policy changes embedded in that piece of legislation, whether it be a $200 million new line item for supportive housing. We know that's a critical tool in our toolbox to deal with many folks who are housing insecure now and need those supportive services in order to stay permanently rehoused and have the supports that they need to be successful. Policy changes like eliminating or allowing for the sealing of eviction records, which we know is a barrier for folks who've had evictions in their past, and that becomes a barrier to being rehoused, removing those barriers. So there's so much that the governor and the administration have been focused on to really combat this housing crisis, but we can't do it alone. Government cannot do it by itself. It needs great partners like Mass General, but also all of the recipients of the grants who are out there in the communities, in the neighborhoods, in the city of Boston and beyond, working on these issues, working with individuals, working with families, day in and day out. So I want to congratulate all the award recipients on the work that you do, being partners with us in the administration, and we look forward to continuing to make an impact and make a difference on our housing crisis. And with that, I'm going to turn it over to somebody who needs no introduction, but it was a great partner with us at HLC, the head of the City of Boston's Housing Office, Sheila Dillon.
Thank you, Ed. Thank you, Ed. So on behalf of Mayor Wu, I am very, very, very pleased to be here today. I think this is a really very important day, one that a lot of us have been waiting for. So I'm just thrilled. I want to thank Mass General Hospital and especially the Community Advisory Board for their effort that they put into this initiative. They really put their heart and soul into understanding what was going to work for Boston and other locations. And they were one of the most dedicated volunteer boards that I have ever come across. And while I'm not here, while I am here to talk about housing, I couldn't agree more with the advisory board's assessment that housing, economic mobility, mental health, and food insecurity are some of our most pressing issues facing our residents. And while the advisory board worked really hard to identify the areas, they also worked really hard to understand what would have the largest impact and what proposals, what activities were being presented were really worth funding. And so I really just want to thank them again. And while Boston's very excited about the many funding awards that are happening today, I know the vast majority of organizations, and I really can't wait to hear about what their proposals are all about. I also am very excited to be here because we are a recipient. So I'm excited about what this means for Boston, but I'm also really excited because we were awarded funding, and I'll tell you a little bit more about that in a second. As I'm going to state the obvious, right? Boston's a fabulous city. It's a wonderful city, and there's amazing people here, and many of you are sitting right before me, and you're doing wonderful things. And it's breaking my heart, and it's breaking all of our hearts that so many of our residents are being pushed out of the city. They can't afford to be here anymore. And just to drive this point home, we have in the office of the Mayor's Office of Housing, we have the Office of Housing Stability that tries to find solutions so people don't lose their housing, right? So they're facing eviction, or they're fighting with their landlord, or they came up short on rent, whatever the issue is. We're getting 600 calls a week. And that number is just going like that. So the situation is getting more and more and more serious. 24% of our residents right now are pretty rent burdened. They're having a hard time paying their rent, 24%. So these awards and everyone's efforts is just so timely and is meeting this very unfortunate moment. So Boston is pulling out all the stops on housing, working with the state, our wonderful partner, and we're building thousands and thousands of new units. You see them all over. So if you live in Boston or you're driving through Boston, a lot of the new construction these days isn't so much market rate housing, but we need to work on that because we do need supply. But most of it is affordable housing that's income restricted. And that's fabulous. That is really good news. We're very happy about that. And we're funding a lot of that with state resources and federal resources as well. But one thing that we're also doing, which I think has just been incredibly successful, we've been at it now for a couple of years, is we're trying to take apartment buildings out of the speculative market, because that's where a lot of the pain happens. If you read real estate ads, it's all I do. I don't know. I'm sort of like, it's how I relax, and I got to find a new way to relax. But you'll hear like, income potential, or delivered vacant, or tenant at with TAW, tenant at will only, right? And all of that is screaming out, this building is for sale and there's going to be a pain associated with it. So several years ago, we got together and we said, how are we going to really increase affordable housing, but also stop all of these pain points? Because those are the calls. My landlord just sold the building, I've got a rent increase. My landlord just sold the building, they've given us 30 days to get out. So we've been working very, very, very hard to help nonprofits and some really good for-profits acquire buildings that are in the market under two conditions, right? We give them resources under two conditions. One, they have to keep the existing tenants, right? They just have to. There's no displacement. Unless something egregious is happening, right? But by and large, there's no displacements. And they have to convert that building into affordable housing. So that those units all become income restricted units. So one, all the tenants have to stay. And two, we have a whole new pipeline of affordable housing projects in Boston. So we were going gangbusters, and then the interest rate climate started going like this, and interest rates got really, really high. And so what's happened is it's really hard for our good nonprofits and some of the non-for-profits to purchase because interest rates are so high. So recently we said, we've got to figure out a fund. We've got to figure out a way that we can provide acquisition funding at much lower interest rates, allowing our wonderful partners to acquire these buildings. And so Mayor Wu has seeded this fund, and we're expecting a little bit more in this budget, but we're expecting a little more after that. And then when we saw this opportunity, MGH's opportunity, we said, let's apply. And at the same time, we were putting together an application. I was getting lots and lots and lots of requests for support letters from all of you, and then some. And I'm like, oh, they're competition. But I appealed to my better self, and I wrote most of them if I believed in what was being presented. But it was, and most of them were good. But I was like, I was starting to feel like, and I actually said to my colleague, Adam Goldstein, we're not going to get this. Everybody's applying for this very important resource. But lo and behold, we did get funded. And we couldn't be happier because, one, it's going to help and grow this fund of low cost capital to take buildings out of the speculative market. But it's also is going to show other funders that MGH believed in this initiative. And that's worth at least the money that we're getting, because now we can use it and we can say MGH funded, won't you? So I am really, really, really thrilled to be here. One, because MGH is supporting so many of the organizations that we believe in. But two, we were awarded funds. And one last thing, it wasn't an easy application process. We were grilled, and I just want to call out Adam Goldstein, it was rapid fire questions. We get out there, we were starting to sweat some. It was an intense process, as it should be. But Adam, thank you so much for your help with this application. It was great. So I'll close there, but I'm excited about what this money could mean for Boston. And I'm just thrilled that today is possible. And I just want to thank you so very, very much. Thanks. It is my honor really to ask the executive director, Elizabeth Jackson from Bridge, to come up and say a few words, also a recipient. Thanks.
Good morning, everyone. I love the call and response. Thank you. On behalf of Bridge Over Troubled Waters, but most importantly, our young people, I would like to thank Mass General Brigham for their commitment in improving community health and in reducing housing insecurity. I would also like to congratulate all of the organizations here today who share the same mission to provide safe and stable housing and improve the lives of those most in need. I used to work at City Life Vida Hermana, so it's nice to see the name there. I was like, oh my God, it's so awesome. That's awesome. Congratulations. Bridge has been helping youth, helping homeless, runaway, and at-risk youth since 1970. For us at Bridge, Mass General Brigham is more than just a world-class healthcare institution. It is our community hospital. In the early 1970s, your doctors helped us start the Bridge Mobile Medical Van, the first in the nation to bring healthcare to youth living on the streets. Your psychiatrists have held regular office hours at Bridge, knowing how important mental health care is for success in housing. I am grateful for this opportunity to share with you the work of Bridge and the impact of this funding on our housing program. Bridge offers transitional and supportive housing programs on different levels of structure and support based on each youth's need. As you know, young people 18, they know how to make their beds. At 20, they still don't know how to make their beds. So we still have to figure out and teach them. The goal is to prepare youth for a lifelong housing independence. For many of our youth who does not get the proper support, they will return back to homelessness. We believe to get them younger, to provide all the wraparound services now so we don't have to deal when they're much older. Well, if they're 22, they still need help. So to achieve this goal, Bridge recognized the need to expand housing opportunities and provide affordable, long-term independent living experiences for homeless youth 18 and 24 who graduate from our transitional living program. In 2018, Bridge launched the next step, our innovative housing model by opening a house in Dorchester for 8 young people. The need for this independent housing model is reflected in the achievements of the first cohort of young people that moved in Dorchester. 100% were employed, with 71% earning a living wage and 86% in post-secondary education. Everything we want for our young kids, for our own kids, right? But this one, together, they had over $100,000 saved. I was like, this is awesome, because their rent was $250. So why not save it? Then we had to now teach them how to invest and how to do other things. But that's all part of learning, right? So we know that the house is more than just, We know that these houses are more than just homes. They are places where young people can build their futures, and your support has made this possible. Yet, like most safe and affordable housing that changes lives, demand quickly exceeded capacity. So we were able to purchase a second house in Brighton, Brunson Liberty House, with the help of Liberty Mutual. It is a triple decker that is over 100 years old. Now it's new. It was 100 years old. Now it's getting a refresh. That needed extensive renovations in order to turn the house into a livable home. Thanks to Mass General Brigham Housing Community, or Mass General Brigham Housing Community Health Impact Fund, we were able to make critical upgrades and rehab work on the house, from remodeling kitchens and bathrooms to new windows, insulation, and ultra efficiency water tanks that the young people don't care about. But they like to take long showers. So we should have put a timer on the shower. I keep forgetting to do those things. The renovations transformed the house into a home and responded to the needs of our young people. I'm excited to share that 9 youth are ready to move in. They will pay $250 a month to live in a safe, secure, affordable, and monitored. We have to monitor them still. Location near public transit. They will be able to use the skills that they acquired in our transitional living program and work on mastering them on their own. While Bridge will continue to provide counseling, case management, education, supportive services, and we will include heat and hot water too. Very nice. The house is a renewable resource though, and will serve many more young adults that once this first round of young people leave, 9 more can move in. When youth move out and rooms are open up, it's the next chapter of their lives, and they can continue to have affordable housing, which is great. We can truly provide the next step for them. For youth looking for a place to learn, grow while they build up their credit, savings, finish school, and start their careers. So on behalf of the many youth we serve, and who will now have an opportunity to start the next step in their lives securely, thank you, Mass General Brigham, for recognizing that housing is healthcare, and affordable housing is essential for healthy communities. So we look forward to continuing our partnership and working with you in the years ahead. Dr. Tavares.
So thank you, Elizabeth, for the work you do and for being here today to celebrate this announcement. And thank you to all of our speakers of today's program. I want to just again thank everyone for being here today for this historic announcement. I want to also thank all of the amazing awardees for your tireless efforts and contributions to the health and well-being of the communities that we serve. As Sheila Dillon said today, I hope that today is an endorsement of all of your work, but also an endorsement that Mass General Brigham believes in all of you and all of the important work that you do. With that, we invite you all to please share in the refreshments that we have for you all today before you step out into the extreme heat that is out there today. But we also invite all of our awardees to please come to the podium, come up to share in a historic picture that we'd like to take and a photo that we'd like to take with all of you. Thank you all for being here. And again, please join us up in the front for a group photo. Thank you, everyone.